the inside story on the issues that affect you and your community. This is Local 12 Newsmakers.
Good morning and welcome to Local 12 Newsmakers. I'm Dan Hurley. The civil disturbances, the riots of 2001, are a point of reference in many discussions. Where have we come in the last 14 years? Have things changed? How much? Sometimes that leads to a discussion of the impact of the transformation of OTR under 3CDC, or to the impact of the adoption of the community-oriented policing program. A third initiative that flowed from the riots and the Cannes Commission that followed was the creation in 2003 of Minority Business Accelerator, the MBA, under the direction of the Cincinnati USA Regional Chamber. Last week, the MBA released its 2014 annual report documenting the growth over the last decade of locally owned minority businesses in terms of economic health, jobs, and productive relationships with large corporations. I am joined now by three people involved with the MBA: Crystal Sherman, the Vice President of Minority Business Accelerator and Economic Inclusion at Cincinnati USA Regional Chamber. Crystal and I are compatriots there at the Chamber, so I have a conflict of interest. Ebow Vroom is the President of Higher Staffing Services and Minority Business Enterprise that is focused on workforce management solutions, and Ben Parks, the President of OV Electric, which specializes in electrical design services for the commercial and industrial markets. Everybody, welcome to Newsmakers. Crystal, welcome back.
Thank you.
And let's get started by just talking a bit about sort of the multiple sides of the work that you're doing. And who can be what you call a portfolio company, a member of the MBA, and what's that mean? What do you then do? What are the services you then provide?
So we have two great examples of firms that are in the portfolio, and they are sizable African American or Hispanic companies. So they have to be at least $1 million in revenue.
So we're talking about larger companies, not just every small store that happens to be on the street.
That is correct. I mean, when we say sizable, it's still it can be still small,
right?
As compared to a Procter and Gamble or Kroger.
Well, yeah.
But they're not micro businesses. I mean, these are companies that have employees, that have established themselves in the market, at least $1 million in revenue, and they have to be headquartered in Cincinnati, USA region. And so they come to us through a variety of ways, some because word of mouth, some because they're working with some of our corporations, and we'll touch on that later,
yes,
I know.
We will.
But they come to us because they're looking to grow faster than what they would under kind of without intervention or without support from us.
Is there also sort of an evaluation of growth potential?
Oh, most definitely.
Okay, so it's not only big, but ability to grow.
We're looking for these firms to grow at least 10% average revenue year over year. Okay. And so when you think about what the market typically does, usually that is either double or triple what the market is doing depending on which year we're talking about. Okay. And so this is all about companies investing in companies that have the potential to add jobs and wealth and really transform our communities.
Okay. Ebow, your firm, Hire, how old is it? What's it doing? And you have an interesting partner too, Dhani Jones, which a lot of people would know his name. So tell me a little bit about your company and how long have you been in the MBA, in the Minority Business Accelerator, and what has it done for your company?
Absolutely, absolutely. So Hire Staffing Services, we established Hire in August of 2013, but we went to market in January 2014. We're a first full-service minority business enterprise where we do workforce augmentation. Essentially, we provide workers for a lot of the companies that we provide our services to. Very consultative within our base. Our industry platforms are mostly within healthcare, manufacturing, as well as professional services. So background's a bit interesting, but yes, my business partner is Dhani Jones, who played for the Cincinnati Bengals here. We went to University of Michigan together. And within that promise, it's really been interesting as far as our injection into the MBA. We just joined the firm, so we're relatively new. We joined May of this year. Okay. And we're really looking towards...
and did you seek out the MBA? Did they seek you out?
So we actually sought out the MBA. We were very strategic in our planning and trying to become involved within it. it was very much an iterative process of working with individuals such as Crystal, as well as Rodney Swopes, who's our portfolio manager within the NBA, because we really wanted to work on developing our growth potential, our board, as well as our prominence within the Cincinnati market.
Ben, how about you? How long have your company, OV Electric, been a member of the NBA?
Well, we've been with the NBA since, I want to say, January, February of this year.
Okay, so relatively new as well.
Yes. And actually, it's Parks OV Electric versus the OV Electric. Parks OV Electric started out as a joint venture back in '09 and evolved into an LLC, a full-blown electrical company. We started in 2009, and we just kind of worked our way, up the ladder, so to speak. I sought out the Minority Business Accelerator.
Okay, and why? What was driving you to seek them out? What did you think they were going to bring to the table?
Well, actually, I looked at the companies that are actually part of the portfolio, and I'm thinking that's where I want to be one day. And I believe that they have what it takes to get me to that next level. As far as the connections, and the respect that they have among the community and the region.
Am I right? Did you grow up here?
Yes.
So
yes.
You sort of grew up here.
Yes.
Okay.
Yes.
Ebow, you didn't grow up here, did you?
I did not.
So there's two different sort of storylines here. I'm sorry, Crystal, you were about to say something.
What I was going to say is I think that's exactly what we wanted, our firms to seek us out. So when we started back in 2003, 2004, no one knew what the NBA could actually accomplish. It was words on a paper. It was theories about if we have a concentrated, intentional effort, we could really make an impact. But, we all kind of kept our fingers crossed that we were right. And so you fast forward, and now we have firms who are coming to us well over the $1 million mark.
They're already established.
Already established, saying, you know what, the kind of companies that you've worked with are exactly where we want to be. And we want to be there in 2-3 years because we know that we can do that.
What's the difference between an accelerator and an incubator, like the Hamilton County incubator out in Norwood? What's the difference here?
So two big differences is one, we don't house these companies. We don't have a physical space. They all have their own operations. Okay. I believe, I'm going to get it wrong, but I think Parks OV is in Butler County.
Yes.
And higher staffing is in the Blue Ash area. And so
this is a regional in focus.
This is a regional focus. We have firms in northern Kentucky and in Ohio. So they have their own physical space, they have their own staff. I mean, these guys are up and running. Right. Versus the incubator, which usually provides some physical space. The other difference is there's no set time for us to work with these firms. We average about 5 years, but we've had firms who have been in there since 2004, 2005.
Well, I want to take a look at a couple of data points that you provided in your report. One is job growth, because people care about not only whether you two guys are getting rich, but whether you're creating jobs. And here's a graph that was in your report, and the green, the lower on the legs, sort of shows minority job growth. So what can you say about your what's the trend line that you see here?
And then I would love for Ben to jump in, because I think he's a great story on that. So we don't mandate that our firms hire minorities or hire women, but in fact they do. And so typically about 50% of their workforce is going to be minority and about 40% is going to be women. Those numbers are higher than anything you would see elsewhere in the marketplace. So while these guys are getting richer, they also are providing opportunities for firms. And I say that tongue-in-cheek because for many years they weren't getting richer. They were
starting a business. I've been there.
Right.
You don't necessarily.
Exactly. But they are providing quality of life jobs for people throughout the community.
So Ben, what about your story? What in your company?
And so to add to that, we train our apprentice through IEC, Independent Electrical Contractors. Right here in Greater Cincinnati, we pay for an apprentice to go to school all 4 years. To get out of school at the end of 4 years, they get a journeyman's license. They're a journeyman electrician. But one of my desires, I've worked for 2 large companies in my whole career, And one of the big things I wanted to do was make sure that I brought minorities into the trade, because I look around, there's not many electricians that look like myself, so I'm thinking I can change
that's your
that.
background, that's your personal background.
Yes. So that was always one of my goals, and right now I have a few men that just graduated. I have some coming up through school right now, and it's a great thing. And a young lady. Finally, I got one young lady to agree to be an electrician, and she's doing well.
And your company supports people going through the training?
Yes. They go to school and they work. So I have people working down at the banks and other places. And
now, Ebow, a little twist on this. I mean, you're a staffing company, and I want to bring up, actually, it's a full screen about the way the larger corporations get involved, and that's the goal setter program, and we'll bring that up in a second. But obviously, relationships with the companies in town that are large enough to do a lot of hiring is important to you.
Absolutely.
What can the MBA do for you in that area?
Great question. The MBA is really helping us with really getting our strategy and our focus together as well. Not saying that we're unfocused, but what it really brings is that additional gravitas. When we look at our board, for example, the ability to form a more successful board of those who are both local as well as broad business minds to really help us scale and grow. From a relationship standpoint as well, as you mentioned, it's our ability to really penetrate those different markets, to really pick up the phone and help us introduce into markets, into companies that we may not have that type of insight to as well. So what we really look for is really that partnership. It's not that partnership of saying, hey, we need to, and can you procure that contract for us? It's really about, hey, it's really about broadening that relationship. Let's begin that partnership so that we can really engage with these companies and help affect our top line.
So having the MBA sitting inside the chamber with the access to the large corporations is really sort of a critical tie here.
When we have cities come to us and say, well, what makes the MBA tick? What makes it successful? I mean, one of the things we say was, one of the best things that ever happened was for the MBA to start at the chamber. Our Cincinnati USA Regional Chamber is where business happens. For small businesses, for medium-sized businesses, for large businesses, it is a convening place where we sit at the nexus of economic activity, economic development, workforce development, talent, leadership programs. And so being there gives us access to these companies, and it gives us access to great minority business talent that exists in this community.
I want to bring that graph back up. It was up when Ebow was starting to talk, but how many corporations in town, the larger established corporations in town, are part of this goal-setting group, and what's that mean, sort of, however you are quantifying it here?
So we have 40, and they're not all, I want to make sure, they're not all large corporations. Right. I mean, we have the large ones, but we also have some of our community organizations like United Way and the Urban League and ArtsWave and the Conventions and Visitors Bureau, who also have made a commitment to spending with local minorities. And that's what it means. It means that they have a stated commitment to spend with local minorities, not just in our portfolio, but with the local florist, the caterer, as well as with staffing and electrical contracting. And they give us a number every year that says this is what we've spent, and we aggregate that. Last year it was $1 billion. I mean, and that is tenfold of where we started when we created the MBA.
In a very short period of time.
In a very short period of time.
So the MBA was created in the early, right after the riots, and so, and then the whole country went into, in 2007, 2008, 2009, into a very bad. I see somebody smiling out of fear, remembering. How much of your growth, and I'm asking you specifically on your companies, how much of your growth is because, gee, just the general economy is getting better, both nationally and locally, and how much it is because of the services that you get from an organization like the MBA specifically?
Well,
Ben, I'll start with you.
I would say, just looking at the connections, and like I said, the respect that other corporations have for the MBA. So if Crystal brings me to, say, Macy's, just to put them out there, all of a sudden they're like, you know what, that's a great outfit, a great company. She's advocating for us. Which makes a difference, because it's not the easiest thing to approach a corporation and just say, I want to do your work.
Hard to know how to get in the front door.
Yes, yes.
And talk to the right person.
Yes, they give us the access, and we do the rest.
And they do, they do the hard work.
Right.
We make the introductions, but one, they wouldn't be in the portfolio if we didn't believe in their ability to provide quality service and to do it in a way that brings value and innovation to the corporations. But at the same time, they're competing against every other company, not just the minority companies, but every other company in this marketplace.
Ebow, I've got about 45 seconds left.
Sure.
But how much interaction is there between the different companies, both African American and Hispanic, inside the portfolio? Do you guys talk with each other a lot? Are you supporting each other?
You have to. That's part of good business practice. We are tasked to really work and create a value-added product, not just within minority-owned businesses, but throughout companies as well. So.
Okay. I want to make sure people know how to get in touch with you.
Okay.
So if you would like to get in touch with the Minority Business Accelerator, you can go to the website, minority-business-accelerator.com, or call 513-579-3156 at Cincinnati USA Regional Chamber. Thank you very much, and good luck in the future economy. Stay tuned. After the break, a growing 4-year-old effort to bring health and educational services to underserved children in the midst of summer. Over the last 3 years, the Hope Fest Health and Education Fair has become a summer staple in Cincinnati. For families looking for fun, ideas to begin getting ready for school, and basic suggestions for healthy living, the right place will be Washington Park on Saturday, July 18th this summer. Welcome back. Hope Fest is the creation of Sherman Bradley through his consulting business, Consider the Poor, and New Life Covenant Church, which he pastors. And he is joined this morning by Melinda Kovacic, I may get it right someday, Kovacic, who is an associate professor at Cincinnati Children's Hospital Medical Center and the UC College of Medicine. Sherman, welcome back. Melinda, welcome. Sorry to keep butchering your name. I've been doing it for a year, so you have no expectations. What can we expect this year, Sherman? Is this just bigger and better, or is there any sort of major changes in Hope Fest now in its 4th year?
Well, it is definitely bigger and better. We have definitely increased the number of vendors that will continue to tackle health and education for our at-risk families that we want to serve. But we're also working very diligently to compile data that Melinda will talk about later that allows us to be more proactive going forward and how we can educate the healthcare community to reach this demographic who typically are not showing up on their doorsteps asking the right kinds of questions.
On a very primitive level, at the end, in terms of data, at the end of last year's Hope Fest, you produced a little video that some data comes in, and let's take a look at that for about 45 seconds,
okay,
and that sets up what Melinda can talk about really nicely.
Correct.
Melinda, that's just some sampling, but Children's Hospital Medical Center has been a partner with Hope Fest from the beginning?
Correct.
Okay, and what's been the role, and it's bigger than maybe people realize?
Well, we help to establish a partnership with each of the screeners that come. That's the first thing that we do. But in addition to that, we have...
So like the little girl who's getting the screening for eyesight.
Right.
And
we
the
help facilitate
breathing.
the people that are going to come and do the screenings.
Okay.
So, and John Scott and his group in community engagement have been really vital to taking over that process in the last year and then this year again. So we originally helped staff that, and at the beginning it was only like 6 different screening areas, and now it's 10, and I think this year we'll have 11 screening areas. So we've really grown the number of screenings we can do as well, and hopefully we can add a few more next year as well.
Okay. And what kind of data has come out of those 3 years of experience with the population that comes? And actually everybody's invited.
Right.
Everybody's invited, but you're especially trying to reach out to the underserved, or whatever term. So what sort of data? What are we seeing?
So what we do is we give each child a passport. We call it the passport, and it's a survey that they are asked to take around to each of the booths. And that one facilitates them getting to every booth, because in some health fairs they might pick and choose where they go. And so a kid might have a vision issue but not know it and skip that vision booth. Now we kind of facilitate making sure they go to each of the booths. So that's the first thing. And then when we collect the data, we have an opportunity to actually see the needs of those kids that come to the day. And some of these kids may not actually see a doctor on a regular basis. They may only use an emergency department for their care. In fact, according to our data, we have 20% of them use an emergency department rather than actually seeing a doctor.
Which has all sorts of implications in terms of costs
Exactly.
and all kinds of things.
Exactly. And then, for example, we found out last year we had 23% of our kids have asthma, and 23%
Wow.
is pretty high. The national average is about 9.3%. We can look at that even deeper because we asked the question about smoking as well. So we saw that over half of the kids who have asthma have a family member in the home that smoke. And that's something we can do something about. And we can see that
Through
using our data.
education,
Right, through education. And when we see a person who has a smoker in the family, we can give them a information on where they might seek help to do a smoking cessation program, for example.
Sherman, lots of data, lots of insight from that data, but stories are also important.
Yes.
Over these 3 years, is there something that sticks with you that is like something that happened at the fest, at the fair, that you said, oh, this is why I want to do this?
The biggest stories, or the greatest impact for me, are the clinics that show up and the relationships that begin to be forged by folk getting to actually go face to face with folk who are in the healthcare community and break down some of those walls and those barriers, especially as it relates to the Latino community that we're reaching out to, that are coming down, that have their challenges culturally as much as they do with health and education in our city. So getting them access to people who they can meet and engage and really just find the warmth that comes from getting to expose to folk who are really passionate about healthcare and wanting to see healthcare changed for this demographic in our city.
So it's not just a one-time interaction, but they may develop a relationship and feel confident about going to one of the clinics? Is that
Absolutely.
what we're saying?
Absolutely.
Right.
And does that happen?
We're trying really hard to capture that data this year. We tried last year. We're going to do a little bit better this year in finding out who was referred and if the people who were referred actually come to the clinics. So, for example, if a child has asthma, undiagnosed asthma, they might, be referred, and then we want to follow up to make sure they have been received care.
When I know I'm just about out of time, but I know in that little video that there was, how many children came last year, and what are you hoping for this year?
Well, we had, I think, around 275 that actually went through all of the stations.
Wow.
We had probably double that number that were in and out, and some were not properly supervised, so they didn't get through all of the stations. We actually gave out over 320 backpacks. We actually had Childhood Food Solutions there that gave out 2,200 boxes of 6 days of non-perishable items to tackle the food insecurity there as well. So there were more children and families than actually went through our actual stations.
And the best thing here is if families come
Yes.
with their children.
Absolutely.
Because it's for a lot of reasons. The supervision, making sure everything happens, and also there may be, like on the asthma, things that the adults need to do that are different that the children don't have any real control over.
And strives there, along with other educational programs tackling for the adults what can happen for the children educationally going forward as well.
Okay, this is a great event every year. Love having you back every year. Let's make sure people know how to find out more information. If you want to participate and learn more about Hope Fest, it's on Saturday, July the 18th, from 11 in the morning till 3 in the afternoon. To learn more about Hope Fest and all the things that Sherman has his fingers in, go to www.sherman-sidellbradley.com, and then there's the Hope Fest on that. There's also a Facebook page for Hope Fest, and you can interact there. Thank you for making Newsmakers a part of your Sunday morning. We end this morning with some more scenes from last year's Hope Fest Education and Health Festival. Have a good week.